Hi, everybody. My name is Lori Mishley. I'm coming from Seattle, Washington to say welcome to Insight 2024, and thank you all for joining us here today. I am honored and excited to be talking to you about my favorite topic, lifestyle modification as a therapeutic strategy for Parkinson's. My disclosures are all listed here. I see patients at Seattle Integrative Medicine. I started the online Parkinson's School program. I am trying to develop a dog sniffing screening test for Parkinson's disease, and I built the Parkinson Pro PD scale, rating scale that we're going to talk about today. And our company has brought you the Pro PD app, the Parkinson symptom tracking app, which is freely available to all of you on iOS and Android. I do research at Bastyr University and University of Washington, and I am a speaker for Accorda. This slide is why I was most excited to give this talk. This conversation about lifestyle modification as a disease-modifying strategy, as a therapeutic strategy, is ripe. It has taken us over 200 years to get here, but we are here. And we are not talking about should you eat your fruits and vegetables and how much bread and pasta can you slip in. The conversation we are having here is much, much, much bigger than that. The fact that we are acknowledging that Parkinsonism is modifiable is a hallmark. It is a game changer in the way we talk about, think about, and address Parkinson's. And my prediction is that in the next 2 years, we are going to see a complete rebranding of Parkinsonism, where we start thinking of it a lot more like type 2 diabetes with people who have predispositions, and there are decisions that you can make that will accelerate or decelerate or reverse or improve. But Parkinsonism isn't this big bad disease with this one thing we have to fix. It is a syndrome that we have to prevent, we have to better manage, and we have to get better at being offensive. In my heart, I really believe that Parkinsonism isn't a neurologic disease, it is a metabolic disease with neurological consequences. And if we start thinking about it like that, there are a lot more tools that we have that we can use to work with to implement change. So there are a couple concepts I would like to convey before we get into the nitty-gritty. The first is that we are getting to Parkinson's way too late. By the time a person has been diagnosed, they have probably had the disease process underway for a decade or two. People are walking around with loss of smell, bowel problems, acting out their dreams, fatigue, anxiety for years before they get a diagnosis. That entire time is a missed opportunity. What I'm going to be talking to you about today is a new field of research called clinical epidemiology, which we have never really applied to Parkinson's disease before, because in order to ask clinical epidemiology questions, you need to be able to measure rate. It is only now that we have the Pro-PD scale that we are able to measure rate. So this is what the legend looks like for the Pro-PD scale. Over here on the left, you see symptomatic therapies. This solid blue line represents average rate of Parkinson's disease progression. The true data in our cohort of 3,000 people we are following looks like the average person gets about 10 good years with Parkinson's. The dotted line is an imaginary trajectory if we were to imagine it just goes straight. Below this, what you see is what the slope would look like if you reduced symptoms by 50%, but didn't change the slope. You can see instead of 10 good years, you get about 17 good years. As opposed to disease modification, where you don't improve symptoms, the only thing you do is change the rate. You cut the rate of progression in half. And what I want to say here is that these first couple of years, it's really not expected that you would see a big difference between broccoli eaters and non-broccoli eaters. But over time, it looks like people who eat vegetables may slow the rate of progression. And the longer you live, the more valuable that's going to be. A couple years ago, we published a study showing that in a North American population, the more days per week of exercise a person reported doing, the fewer Parkinson's symptoms they had. Being lonely was almost as bad for you as 7 days a week of exercise was good for you in a community of people with Parkinson's in a real world, as opposed to explanative research, which is mostly what gets funded in this day and age, and forever. But historically, most of our energy has gone into explanative research, which tells us why. So earlier this year, there was a study that said people who did 6 months of intense exercise had more dopamine in their brain before and after the 6 month intervention. So they weren't so much focused on clinical outcomes, they were focused on dopamine levels going up. So my research can't tell you anything about the why. It just tells you, did it work or not work? Are people doing better or not? And back to that loneliness thing, Dr. Supermanian is going to talk about social health and Parkinson's disease. So I'm not going to cover that much here, but truly people who are lonely, being poor and being lonely are two of the single biggest predictors of Parkinson's disease outcomes. I wasn't expecting this at the start of the study, but being single is really a huge threat to quality of life in Parkinson's. When your quality of life is poor, there's a 50-50 chance that you are partnered or singled. But when we look at people who say my quality of life is excellent, only 9% of them are single. Right? That is a whole world we need to dive into to understand what is it about partnerships and community that might be influential or improving people's quality of life. So while the researchers are working to figure out the why, my suggestion is you should make some friends and get some exercise. There are a ton of studies, 12 to 17, that say if a person with Parkinson's who has trouble with their balance does Tai Chi 2 to 3 days a week, that their balance improves. You get to check the balance improvement box, you get to check the community box, you get to check the physical activity box. There are little things you can do that seem to be paying off. Pickleball is a great one-step shopping. It is social, it is pushes your comfort zone. You have to be present. You can't multitask. It's cognitively challenging. It's outside most people's comfort zone. Every minute is a little bit different than the minute before it. You have to be in the game. And so these are the things that seem to be working really well in Parkinson's disease. Okay, so we're about to dive into nutrition, supplements, some of the things that people are really looking to hear about. Before I do, I just want to remind all of you, association does not mean causation. What I'm about to tell you today is we know that the people who are doing poorly, we can describe to you who they are, what they're like. What are they eating? How many friends do they have? What's their credit score? That doesn't mean that if you change your credit score or eat more Brussels sprouts that you will improve Parkinson's. We haven't gotten there yet. So we are almost at the place though where we can tell you why you progress. I can tell you people who make less than 80,000 US dollars a year are in worse shape than people who are above 80,000. People who have more friends do better than people who don't have friends. More physical exercise is better than less. Plant-based diet is definitely better than fried foods, dead animals, and mammalian milk, right? There's a list of about 10 to 12 supplements that seem to be associated with Parkinson's progression. We are just getting started, but this is a whole new era of Parkinson's disease care where we're actually talking about stuff like this. So what we have been doing here based in Seattle, but it's a global study for the last 10 years, is looking at people who have a diagnosis of Parkinson's, who are at risk of a diagnosis of Parkinson's disease, have early symptoms of Parkinson's, and we are following them over time to see if anything that they do influences whether they get Parkinson's or whether their Parkinson's progresses slower, stays stable, or reverses. Okay, so what we did is we looked at two very popular diets in Parkinson's disease, the Mediterranean diet and the MIND diet. And what we saw is both of them were associated with better Parkinson's outcomes over time. But the MIND diet was actually twice as good as the Mediterranean diet, or decreasing symptoms. Again, decreasing implies causation. This was just an association. But what we saw is the more a person increases their adherence to the MIND diet, the more a person eats a MIND type diet, the less urinary, sexual, and cognitive dysfunction they had, the less muscle pain they had, the less fewer sleep problems they had, the fewer mood disorder symptoms they had, less anxiety, depression, apathy, and less constipation. Why? I don't know. Is it the fiber? Is it the antioxidants? Is it the microbiome? I don't know. I don't care. Just eat those foods. So here's where things start to get tough. They're both good. Mine seems to be a little bit better, but what we see is the only foods on the Mediterranean and MIND diet that really seem to be responsible for the benefit that we're seeing in Parkinson's disease are these foods in the inner circle. And so there are some similarities. They both have nuts, they both have vegetables, there start to be some patterns, but what we really see is that there are just a few variables in each diet that are carrying the weight, right? The reason the Mediterranean diet is good is just because of a few strategic questions. And so instead of trying to fit a Mediterranean and a MIND diet into Parkinson's disease, what we decided to do is take a step back, not have any preconceived notions about what a good diet was, and just simply ask the question, when we look out, cast a wide net at people with Parkinson's, who are the people who are in the worst shape fastest? What are they eating? What are they doing? How many friends do they have? How much do they exercise? And these people down here whose quality of life is excellent or good longest, what are they doing? This is the answer key. The size of the font is proportional to the effect size of the variable. It does seem that the bad foods are more bad than the good foods are more good. But again, we don't actually know what this means, right? We don't know what causes what. Some of these things just might be along for the ride. But I want to start by just flashing before you good foods. I want you to see what healthy looks like. Fresh vegetables are more good than fresh fruit. Fresh fruit is more good than coconut oil, and coconut oil is more good than olive oil, which is equally good to spices, right? This over the last 10 years, these numbers are going to be a little different in a different cohort of people in a different year. They're going to change a bit, but what we can see in here that there are varying levels of effect size, and I think in there we can get some hints and start to be strategic about how we fill our stomachs. Nuts, seeds, common in this diet, which we're calling the PRO diet based on patient-reported outcomes, the Mediterranean diet, and the MIND diet. Fruit, the MIND diet specifically advocates not just fruit, but berries. We will do a better job distinguishing in future studies. Fish is associated with better outcomes over time. We don't know about other forms of seafood, shellfish, eel, herbs, and spices are definitely associated with better outcomes over time. Coconut oil and olive oil, coconut oil even more so than olive oil, which was a little surprising. Legumes, not surprising. Green tea and wine. And the most popular question that I have received in the last 10 years is red or white. And the answer is red. This is where it starts to get complicated. If a person is 65 years old and does not have a habit of drinking alcohol, should they start drinking wine because they think it's going to improve their Parkinson's symptoms? I truly don't think they should. It's my personal opinion that the net impact of alcohol is probably more negative than positive, and I don't think a non-drinker should start drinking. If there is a person who is a social drinker who could trade out their Jack and Coke for red wine, maybe that makes sense. But we don't know what it is about wine. Is it the wine or is it something about red wine drinkers? Do they have a little more disposable income? Are they a little more social when they're drinking together? Maybe it has nothing to do with their drinking, but the huffing, the smelling of these neuroprotective, antioxidant, volatile compounds that are going straight to the brain, right? Maybe wine is a delivery system for these anthocyanins. We don't know the why. We don't know the if. We don't know how much you can steer your ship. But we can say with 95% confidence that the people who are doing the best are eating the most of those foods we just talked about. And when I say that, nobody acts surprised, nobody argues. People generally say things like, duh. Of course, that's the same thing we see in heart disease and Alzheimer's and cancer and longevity, et cetera, et cetera. Agreed. I'm happy to see we're seeing congruent results. What we have done a little bit differently is looked at the bad foods. More than most other studies, we have looked to see whether or not there might be some causative contributors in our food. People tend to not appreciate that diet is an environmental exposure. When we say the word environmental exposure to people, they tend to think air, they tend to think nuclear power plants, they tend to think oil spills. They don't realize that food is one of the single most significant environmental contributors to their overall burden. So just like on the good list, we have a list of foods associated with worse outcomes, association, not causation. But as you can see, some foods are more bad than other foods. The way we are using this scale, and it's hard for people to do the math, eventually we'll build an app that can do this for you. But basically, say you are a person who eats a half cup of ice cream 3 days a week. So what you would do is ice cream has a score of 31 points. 3 days a week means multiply it by 5. 31 times 5 is 155. A person who eats a half cup of ice cream 3 days a week is scoring about 155 points more than a person not eating ice cream. Again, I'm reminding all of you, this isn't my opinion. This isn't my opinion. This is just the data. When I asked thousands of you, hey, how are you? Who are you? And what are you doing? I compared the foods you all were eating, and I can tell you, the more of these foods a person ate, the more symptomatic they tended to be. Okay, this is perhaps the most complicated part of this whole talk. I just want to say it really quick. Temporal trends refer to change over time. We have seen clear as day that the more canned fruit and canned vegetables a person eats, the more symptomatic they are. Each step of the way in this study, people started asking us, what about canned fish, canned beans, canned coconut milk, canned tomato paste? And so as we've started asking more questions, all of a sudden in 2022, the only canned product associated with worse outcomes was canned fruit. We don't know why, but that's an example of, we don't know if we should advise you to avoid canned beans or tell you, hey, based on the most recent year, canned beans were fine, go for it. This is where we need a team of people asking more and more cohorts around the world, more difficult questions so we can get those answers for you. Dairy products, this is where most of you are most resistant. Go kicking and screaming, try to find the most loopholes that allow you to continue to eat dairy products. But I'm here to tell you there have been lots and lots of studies from different researchers in different countries at different periods of time that have all come up with the same answer. The more dairy you eat, the more likely you are to be diagnosed with Parkinson's. That isn't a question at this point. This isn't what we call equivocal data where we argue about it. This is crystal clear. Soda, maybe that means sugar-sweetened beverages, maybe that means carbonation, maybe it has nothing to do with the drink, but the plastic water bottles or the cans it comes in. We don't know why fried food is bad. There's a chemical called acrolein. Every one of you should know that word, acrolein, and we should be doing a lot more research on the impact of acrolein in our diets and our brain health. But there are a lot of reasons to be worried about fried food. Breads and pastas could themselves be problematic. It could be something that we are adding to preserve their whiteness or make them last longer. It could be the way that we are cooking them. It could be that we are filling our bread with meat or coating our pasta with cheese. And so it's really the meat and the cheese that are not the bread and the pasta. Maybe these processed grains are feeding a different microbiome. We don't know why. Maybe it has nothing to do with pasta and bread. Maybe pasta and bread are just taking up space that really needed to go to fruits, vegetables, nuts, seeds, and fish. So there's a lot to learn here, but what we can tell you with 95% confidence is the people who are doing the worst are eating more bread and pasta than people who are doing the best. Drinking from plastic bottles, eating beef, chicken, and pork. For some reason, chicken has been consistently associated with worse outcomes. Turkey has not. Frozen vegetables are associated with worse outcomes. Frozen fruit is not. It could be an error in the data. It could be that there are different levels of pesticides in vegetables as opposed to fruit. It could be something to do with the preparation. We blanch veggies prior to freezing them. We don't blanch fruit. It could just be poor people eat more frozen vegetables. Juice, I can't believe that the juice you juice in your home juicer is bad. I'm more inclined to count that as fresh fruit and fresh vegetables. But what we do see is people who eat more juice do worse over time. So I've thrown a lot of foods at you. I know it's all a little confusing and different people have different opinions. But I will remind you that none of what I'm talking to you about today here is my opinion. What we have done is asked a couple thousand people with Parkinson's what symptoms they have and what foods they eat. We combined those data into the patient-reported outcomes diet, PRO diet, and we can tell you that the people with the fewest symptoms eat these foods in green, the people with the most symptoms eat these foods in red, and what we are seeing isn't that different than what has historically been seen in the mind, the Mediterranean, and even a little bit the ketogenic diet. So for those of you who want to get started, there's a lot of overlap here. There are things to encourage, things to avoid. Supplements, I don't know if those are medicines or modifiable variables. We're not going to talk about those much here, especially because this is such a global cohort. But last year, we did publish a study showing that there were about 12 supplements that were statistically associated with better outcomes over time. This isn't a shopping list. Some of these are contraindicated. I don't want you all to go start all of these, but I do think that these are supplements that researchers need to start spending more time on, and doctors need to be up to date on to have intelligent conversations with their patients about whether or not they should or should not start any of these supplements. So in summary, we're here. We are here. We are at the stage where we can almost tell you why Parkinson's is progressing. We can't tell you the cure. We can't tell you how much you need to change it to make it happen, but we are almost at the point where we can give you the answer key and tell you the reason people are progressing are because of these 12 variables. And that is ushering in an entire new genre of Parkinson's care. We need more of you to participate in the MVP study. The more of you participate, the more we learn and the more granular our analyses can be. We have a huge North American bias. We can already see huge disparities. People in some parts of this world are progressing much, much faster than people in other parts of the world. We can see it just by eyeballing those data now, but we need more of you from more parts of the world to enroll in the MVP study and start using the MVP app so that we can track and report on these data and increase awareness and solutions. Thanks to a very generous donation from a community member, Don Johnson, the ProPD rating scale, which is a validated measure of Parkinson's disease severity and allows you to track your rate of Parkinson's progression and reversal, is now freely available on iOS and Android. My recommendation is that you download this, whether you have Parkinson's disease or not. Everybody should know their ProPD score. I made a bunch of coupons for anybody who wants to check out Parkinson's School. We have lots of monthly meetings. If you go to the $10 a month membership, hit enroll now, add coupon, Insight 2024, apply, becomes free. Thank you very much for the opportunity to be here. I can be reached at Education is Medicine, the Parkinson School website. Thank you very much.